First is Dr. Louise Harris, who's a professor of medicine at the University of Toronto, a senior staff cardiologist, and an electrophysiologist here at UHN. She's worked at UHN as a resident, fellow, and staff physician over an astonishing 40-year period. She's had a major commitment to understanding electrophysiological aspects of complex congenital heart disease in adults, with research publications and an international reputation in the discipline. She's been involved in teaching at the undergrad and postgraduate level and previously served for a decade on the Department of Medicine Promotion Committee. As it relates to today, we're very excited to have Dr. Harris share her expertise. She currently serves as the interim UHN lead in wellness and is actively involved in mentorship and allyship initiatives. Our second presenter for today is Michelle Kirkwood, and Michelle is an experienced HR leader with an impressive career trajectory in the financial sector. She brings with her a wealth of knowledge and experience in organizational design, managing large-scale initiatives, specifically in fast-paced, high-change environments, which I'm sure we can all agree UHN is one. With a client-focused approach, Michelle has a proven track record for building consensus and achieving positive outcomes through collaborative approaches. Michelle joined UHN new to the healthcare and public sector 15 months ago, and she currently leads the corporate portfolio, which includes TNI, UHN Digital, HR strategy for Synapse, clinical performance, Altum Health, and FM Pro, while also providing strategy HR support to a number of our external clients. Michelle also currently participates on a burnout committee under the leadership of Dr. Barry Rubin, who I know has joined us today, and is supporting interventions at both Princess Margaret and Peter Munk, and has partnered to build an in-house program to support non-clinical burnout. So if we flip to the next slide, we're going to start with a bit of some context setting led by Michelle in terms of really what is burnout and exploring clinical burnout and extrapolating from that learnings for our non-clinical folks as well. And then move into a period of storytelling from both Michelle and Louise. If time allows, we will open it up to general questions. And so please do feel free to use the chat section to send through any questions that you may have. Again, hoping that time allows. And so with that, I'm very pleased to hand it over to Michelle.
Great, thank you so much, Jenny, and good afternoon and welcome everyone. So we're going to start with a little bit of an engagement exercise. And so I'm going to ask you to take out your phones and please scan the code that you see here. And as you think of the word burnout, what is the one word that comes to mind for you? And I'm going to give everyone a minute to scan and participate. Thank you, everyone, for participating. We can see some words really starting to come out here. The word exhaustion, exhausted, definitely the most common word. Feeling overwhelmed, stress, tiredness, fatigue. And I'm going to pick up on some of these words around stress, exhaustion, the feeling of overwhelmed, overworked, unmotivated as we continue in the presentation. So thank you so much for participating. So Veronica, if we could go to the next slide, please. And so what is burnout? And, you know, I'm borrowing from some of the work that we've done under the leadership of Dr. Barry Rubin. And you see a definition here, work-related syndrome characterized by emotional exhaustion, a sense of reduced personal accomplishment, and depersonalization that may manifest as negativity, cynicism, and the inability to express empathy or grief. And, you know, as I prepared for this session and I started to think about situations over the past 15 months that sort of led me to that place of maybe I'm heading towards burnout, some of the things that I felt, so some of the ways in which it manifested itself for me, and you may feel this, and you know, it certainly showed some similarities as we put the word cloud together. That feeling of insomnia, the feeling of getting up many times at night. So, you know, you kind of fall asleep, but you're constantly up and trying to get back to sleep. The feeling of retreating. I know when I'm not my best, or I feel like I'm getting to that place where I can't manage anymore, I tend to retreat socially. And then, you know, not being able to ever completely switch off from work. So those are sort of a few feelings that I've certainly had, you know, in moments where I think I've got to try and find some better balance. And then on the next slide, again, carrying on with some of the work that we've been doing with Peter Monk and Princess Margaret, we started to capture what are some of the impacts of clinical background, of clinical burnout. Sorry, and I'm gonna balance that with what some of our non-clinical teams have been telling us as well. But certainly on the clinical side, there are 3 areas that we wanted to highlight: patient care, clinician health, and healthcare systems. And around patient care, it's the increased risk of medical errors, serious safety events, reduced patient satisfaction, and even worse than that, patient outcomes. On the clinician health side, associated with decreased provider quality of life, high fatigue, job turnover, suicidal ideation, and death by suicide. And, you know, as I think about some of the work that we've been doing on the non-clinical side as well, we've seen reduced performance, we've seen absenteeism, we've seen attrition, we've seen short-term disability taking us into long-term disability, and again, high fatigue and exhaustion. And then on the healthcare system, negative economic impacts due to decreased efficiency of healthcare delivery, reduced clinical hours, and then costs associated with clinician turnover. And seeing that same thing on the non-clinical side as well, the costs of turnover and attrition, and the fact that it seriously impacts our employees' health in general. Our employees have challenges with creating balance, and those environmental and personal stresses can create huge burnout. Can we go to the next slide, please? And so as you think about, and I'm sure all of us over the past 15 months have had a number of barriers that we've had to overcome, boundaries that we've had to create for ourselves to create better balance, I want to engage you in another word cloud. And this time, the question I want you to consider is, what is the one thing you are going to do to help create better boundaries for yourself?
Michelle, I just wanted to jump in because I think we were actually going to end the session. So we want folks to think about this as we go through some of the storytelling, and then we'll come back to this question because hopefully through some of the storytelling, we'll have given you a couple of new ideas as well.
Wonderful, absolutely, and people can still continue to participate. Slido is open. Thank you.
Thank you, Michelle. And so we wanted to start with that context setting because quite often the first step in really helping yourself through burnout is to just first identify it and know and recognize, hey, you know what, that's what I'm feeling. And so over the next 2 questions, we really wanted to start to explore some of the causes of burnout as well as some of the things that we can do to stop it. And so I wanted to first start with Louise. And Louise, if you could share with us, if you had felt over your long and distinguished career, did you ever feel that being a woman has actually uniquely contributed to burnout at any point in your career?
Yeah, so I find the question interesting because I've thought about it in two ways. And for one, for sure, burnout affects everybody. And I think it's important to recognize that men will experience burnout, which may manifest differently than women. So I don't really have an answer in the sense of burnout as a woman. I can certainly speak to many of the issues of being discriminated as a woman in the field, both by patients and by colleagues, just in a similar vein to that described by your keynote speaker. So that for sure has been around, and that does identify you differently than a man. But men do experience burnout. And the more I thought about the topic, it's really sort of, there are two components to it. So one really is personal sense of burnout. And that is probably where it more impacts on women, because women traditionally are carrying more of the household responsibilities. And in fact, if you look at any survey on physicians, and that's just the one example, there's no question that women experience burnout by virtue of being more responsible for childcare and running a household and caring for elderly parents than do men. But I think the burnout also has very much an institutional component. And I think we can't think of burnout solely as, you know, my problem, your problem, you're not balancing things well enough. We have to recognize, and I think that's where a forum like this is incredibly helpful, to force the institution and the people in the institution to recognize that a lot of burnout is institutional, feeling not empowered to speak up, feeling, well, you know, even when I looked at the Mayo Clinic worksite, they talk about dysfunctional workplace dynamics and, you know, people who are bullies, lack of control, and not feeling you're able to influence the factors that affect your job. And certainly I can speak to a number of those issues, having experienced them personally. But at the same time, those are not my problems as a woman. Those are largely institutional factors that we really need to recognize and collectively work hard to correct. And I think one of the things that came out of my thoughts about this, well, if we're sitting here talking about burnout, recognizing burnout, what can we do to mitigate burnout? And I know there's lots of initiatives that Michelle alluded to from Barry's work, looking at, doing exercise, doing meditation, and so on. But I think if we look at the institutional aspects, it seems to me a lot of it's about empowerment. And there was just very recently a study that came out during COVID about nursing, and studying a group of nurses, and those who felt empowered to speak up or take some control over their day-to-day work life actually had a much lower incidence of burnout. And so I think that's a starting point for the institution and those of us that work here to value that empowerment for all of us. And I think some of the women who spoke about that very early on from in your little slideshow or your video, I think they identified that.
Thank you very much, Louise. And I think one of the more powerful items that you just said is this notion of institutional burnout. And when we get to that last question, Warren Cloud, I actually am going to challenge us all to reframe the way that we even posed the question, because we posed it as, what are you going to do to set boundaries and eliminate burnout? But you raised such a great point that it isn't just a personal issue. And as an organization and UHN women, we should be looking at those institutional factors. So thank you so much. So now I wanted to turn to Michelle, and knowing the wealth of experience you have in this area and recognizing your recent change from the financial industry into the healthcare industry, could you tell us a little bit about your experience in creating boundaries in the workplace?
Absolutely, Jenny. And this is it's been a really interesting journey for me, definitely coming into healthcare from the private sector, joining UHN in November of 2020 in the middle of the third wave, and having to very quickly build trust, relationships in a remote environment, and try to experience some quick wins so that I could gain credibility with a number of executives and their teams across a very big portfolio. And I had to be flexible to attend meetings as needed and not ever say no, to say yes all the time, because I felt that I needed to do that in order to build the credibility and have the quick wins. And so what happened was my meetings started to get earlier and earlier, and later and later. And before I knew it, I was working 12 to 14 hours consistently. And I very quickly realized I had to create some boundaries for myself. And I was actually in one of the non-clinical burnout sessions that we were delivering to UHN Digital and our Synapse project colleagues. And somebody put up their hand and said, I have two non-negotiables that I do on a daily basis. And no matter what happens in my day, I make sure those two non-negotiables get done. And that helps create boundaries for myself. And I thought, oh my God, that is such a simple lesson to take and adopt. I'm going to do the same thing. And so I created some boundaries for myself. Monday, Wednesday, Friday, from 6 to 7 a.m., my husband and I work out together in our basement. I come into the office right now every Tuesday and Thursday. So those are my in-person days. And I make sure as many meetings are done in person to create that connection with my business partners and my team. My husband and I walk our puppy every evening, and that gives us a chance to reconnect on our day and share stories. And we try very, very hard to have family dinners 3 times a week. My kids are 23 and 17, so not always easy to get everyone together. And the last story that I want to share is one of my mentors asked me one day, what do I want to put on my tombstone? And I thought that it was such a morbid question. And I went away and I thought about it and I went, very simple. I want to be the best wife, the best mother, the best daughter, and the best mom. And so for me to be able to do that, I have to shift and make some changes in my life and create the kind of boundaries that allow me to bring all of myself to every interaction, whether that's at work or at home. So hoping some of my lessons can help encourage. And Jenny, I see Barry has his hand up.
I actually would like to respond before Barry goes ahead. I actually would like to respond to that. I think that we should not, in this institution or any institution, have women think that they have to be the best mother, the best caregiver, the best doctor, the best daughter, because that is setting yourself up for a fall. So I think in part the boundary has to be, we want to we can't, this notion of having it all and being perfect, never going to happen. And I think to some extent, you have to accept that there will be things that you cannot accomplish and be okay with that. So part of that is self-care, is saying, I have to weigh which activity I really can't miss and just forgo the other. You have to recognize that you have to have a boundary that says it's okay not to be the best at everything. So I'm sorry, Michelle, but I think it is an important point, because so many women feel, and I've heard it endlessly over the years, that I always feel I'm neglecting my household, I'm neglecting my children because I'm at work, or if I'm home, I'm neglecting work. And I think we have to accept that there's always going to be a trade-off, and the lesson to be learned here to avoid burnout is to say, I'm okay with not doing everything and not being perfect at everything. And I'm just going to finish with, I wanted to share one story about, I think it's a little bit about empowerment, personal empowerment in terms of setting boundaries. Many years ago, and this is sort of a female never knowing how to say no story. I was hired here as a clinician teacher, and every year I was approached to do a particular course of teaching that was very time consuming and non-remunerative. And I did it, as did many of my colleagues. And then it dawned on me that it was the women who were disproportionately being asked to do the teaching. Now, the issue here wasn't to go to the person who was handing out the teaching and say, hey, you're giving me more than a guy. It was to get the data and the evidence. So I counted out how many people were clinician teachers in the division of cardiology. And then I went back to him and said, by my calculation, I mean, he was coming to every woman. I said, by my calculation, there's so many clinician teachers hired here. I will do my fair share, which means you come to me once in 5 years. And so it's getting the evidence, not being confrontational, but getting the evidence and feeling empowered to take that forward in a rational manner and ask for fairness. And that's how I would encourage it. That's what I would ask people to take away from this, to get the evidence, prove your point, do so in a rational voice without arguing, but feel empowered, as the keynote speaker said, to speak the truth.
That's wonderful. Thank you so much, Louise and Michelle. And I see, Barry, you put your note in the chat. So I appreciate that, because we are unfortunately out of time. I would ask if folks have a moment, if Veronica, if we could pull up the Slido, and we'll sort of revisit that question. And again, let's challenge ourselves to not just think of what's the one thing you do, you're going to do, but what's one thing that UHN could do? What are some of those institutional factors that could help us to create better boundaries, but also to help to address burnout? So we thank you all for staying a little bit over time, and we'll watch the Slido really sort of come to life. And folks that have the time, please do stay. We apologize that it really was a crash course in burnout, but hopefully you're leaving with a few lessons learned and some items to have some personal reflection on. We really look forward to working with you all as the UHN Women's Strategy starts coming to life. It's been said a couple times before, but this really is intended to be a grassroots strategy. So no need to wait for us to launch something or do anything. Please engage with us on Twitter, on Facebook, through the email address that was shared, and get started. Get started tomorrow if you'd like. We're really looking forward to working with you all. So thank you.
Thanks, Jenny. Thanks, everyone.